if you know how to stimulate your body in the right way. And that's really what this is all about. If you know how to stimulate in the right way and get the hormone balance going, then you start getting great results. So, our low intensity, long duration exercise, it's bad because it raises the cortisol, it lowers the HGH and the testosterone. So when we talk about metabolic conditioning, it actually does the opposite. Okay? The surge training, the max T3, going really hard and then relaxing and really hard and relaxing, that does the opposite. This drives down the cortisol. Remember, cortisol tells you to eat more and store fat. It drives that down so your body doesn't hear that. And it drives up the HGH and the testosterone. And that's what tells your body to burn fat and build lean muscle. Okay? So we want the HGH and the testosterone high. That's what metabolic conditioning does. And that's why this works. That's why you get the results that you do. So here's a cute little cartoon. It's a doctor looking at his patient. He's trying to get his patient to exercise more for his overall health, and the patient's giving him the old, I don't have time to exercise, right? And the doctor says, well, what fits better into your schedule? Exercising 12 minutes a day or being dead 24 hours a day? Right? All right, nobody found it funny, but I did. So here we go, fat loss. So let's look at the studies that back this up. Fat loss with high intensity exercise. Again, when we study rats, we find that more fat is lost when they exercise at high intensity as compared to the rats that exercise at a low intensity. This is the interesting part. Despite both groups working at the same amount of workload. So what this means, to take it out of study terms, what this means is if you take two people and they do the same amount of work, we're both going to travel 1 mile, okay? One guy's going to just jog it real light and he travels 1 mile. The other guy's going to sprint for 10 or 20 seconds and then he's just going to walk. And then he's going to sprint for 10 or 20 seconds and he's just going to walk. They cover the same distance. Their workload is the same. The guy that did the high intensity intervals burned more fat. That's what I'm telling you. So again, we like to look to the studies to prove what we're talking about here. Losing fat with metabolic conditioning, again, a greater increase in fat loss after high-intensity exercise due to the release of the growth hormone, which we talked about. Positive relationship between carbohydrate expenditure during exercise and fat expenditure during recovery. Guys, I don't expect you to understand what that means, but I use the PowerPoint so I know where I'm going. So I read it and now I explain it. So what this means is that this here, talking about the carbohydrate expenditure, let me explain your physiology to you in real simple terms as far as how this works and what this means. When you exercise really hard at a high intensity, your body primarily burns carbohydrate for its fuel source. That's where it gets its energy to do what you're demanding, okay? If you work out at a light intensity or moderate intensity, your body primarily burns fat, okay? Not carbohydrate. And what this study is saying is that what they found is when you burn more carbohydrate during the exercise, working really hard, you had a greater expenditure of fat after the exercise. So it almost seems counterintuitive because, and this is where people have gotten screwed up, okay? They think that going and jogging for a long period of time will burn fat, and it will during the time that you're exercising. But the problem is that once you stop exercising, your burn is done. You don't get any more benefit from that after the exercise. Versus doing a max T3 workout, when you're working out and you're working that hard, you're primarily burning carbohydrate. You're not burning fat. So you might think, well, I don't want to do that. I want to burn fat, right? Well, the reason this is so far better, I can't think of a better term than better. The reason it's so far superior is because this is what happens. When you work out really hard and you're burning those carbohydrates, you deplete the muscle store of the carbohydrate and the glycogen, it's called, that's in your muscles, all right? You deplete that when you work out that hard, and it doesn't take long to deplete it. In 12 minutes exercise, it's gone, okay, depleted. Now your body is going to frantically say, I've got to do what I can to restore those glycogen or carbohydrate stores in the muscles. Where's it going to get it from? It's going to go to the fat. It's going to go to the fat, it's going to break down the fat, turn it into carbohydrate to replenish the stores. And it does this over the next 36 hours after you exercise. Day and a half. So if all that mumbo jumbo didn't make any sense to you because it's too much physiology, what I'm telling you is that if you go out and jog, you will burn calories and burn fat while you're jogging, and when you stop jogging, you're done. No more benefit till you jog again. You do a Max T3 workout, you are going to be burning fat and calories for a day and a half after you did that exercise, even if you do nothing else after the exercise. Who would rather burn calories for a day and a half versus only 40 minutes while you're jogging? Yeah, right, no brainer. Yeah. That's what I'm talking about here, and that's what this study is showing and what it means. So here's a common one. You'll find people will say, why can't I lose weight? You know, they feel like they're trying, you know, I'm going out, I'm walking, I'm jogging, I'm starting to exercise more, I'm trying to eat more salads instead of burgers, you know, whatever. Why can't I lose weight? Or maybe you have the person that hits the weight loss barrier. You know, they've lost some weight and all of a sudden they plateaued and they can't get through the plateau. Well, let's talk about why that occurs. Basically, there's a hormone in your body called leptin. And what leptin does is it tells your body, I'm full, I don't want to eat any more food, and I want to start burning some fat for energy. Okay, so leptin's a good thing. It tells you you're full, it suppresses your appetite, it burns more, it tells you to burn fat.
I don't have that.
Yeah. What happens? Yeah. What happens in some people when they become weight loss resistant or leptin resistant is because of the foods you're eating, maybe the amount of the foods, the types of the foods, or the frequency of the foods that you're eating. Every time you eat that, your brain hears leptin saying, "I'm full, let's burn fat. I'm full, let's burn fat." Pretty soon your brain says, "I don't want to listen to leptin anymore. I'm sick of listening to leptin, okay? Getting annoying." So the brain stops listening and you become what's called leptin resistant, where the leptin will go up when you eat, but your brain won't listen to it, it doesn't hear it. So if you become leptin resistant, now you're going to start running this, why can't I lose weight, or why did I plateau? Well, you become leptin resistant more than likely. So what happens is now you eat the foods and you still feel hungry all the time. Because you don't have leptin telling you, hey, I'm full, I don't want any more food. You just keep wanting to eat. And now there's no leptin telling your body to burn fat. So you just are storing it. You're putting it on, and you know the old saying, it goes right to my hips? Yeah, pretty much in that case. You're putting it in, and it's going somewhere to be stored as fat. So what you have to do is break through that barrier and reverse the leptin resistance. Okay, well, how do you do that? Basically, it's as simple as Max T3, and then what's called the Advanced Plan in the Maximize Living Nutrition book, which we're not getting into tonight. We've talked about that before. We'll talk about it again. If you want to know more about that, talk to me afterwards. But basically the bottom line is you've got to cut out sugar and the things that turn into sugar. And then you do your Max T3. And then your leptin resistance will be reversed. You won't be leptin resistant. Okay? So, why can't I lose weight? Well, look at the studies again. If you're somebody that's wondering, why can't I lose weight, but all you're doing is you're going out and walking or jogging, if you look at the studies, they're going to tell you that people in study groups that worked out near their maximum capacity for a short period of time burned significant fat, had significant weight loss, compared to no significant change in the group that was just working out at a light to moderate intensity, doing the same amount of work. Okay? So we look at metabolic syndrome. What metabolic syndrome is a syndrome that's basically characterized by different things like being overweight, having a really large waist circumference, having high blood sugar, having high cholesterol, having high blood pressure. All these things we call them metabolic syndrome. When metabolic syndrome was studied with this high intensity exercise, what they found is after 16 weeks of doing this type of training, they reversed most all the risk factors with metabolic syndrome, and over half of the people didn't have metabolic syndrome at all anymore. And this was without a single dietary change. Okay? So that's pretty cool, because what this tells you is even if you're somebody that can't make a single dietary change, you say, look, I just love my burgers too much, I can't give them up, what this study is telling you is that if you adhere to a Max T3 program, even if you don't change how you're eating, you still are going to reverse metabolic syndrome, more than likely. And on the flip side, we always talk about how important diet is, because I don't mean to minimize it. It is really important. Think about how much better results you could even get if you could also implement a good eating plan with that. The icing on the cake. But don't, yeah.
No icing.
Good one. So what are the results of the metabolic conditioning? Again, increased growth hormone, testosterone, causes your fat to be burned for 36 hours, not just the time you're doing it, builds muscle instead of muscle wasting. Maybe you didn't realize this, but you actually are encouraging muscle wasting when you go through a program of low intensity exercise over a long duration. It's because cortisol, that's what gets increased when you do it. It's catabolic in nature, meaning it breaks down proteins. That's what your muscles are made of. Muscle wasting is more likely to happen if you're doing long duration, low intensity exercise. So, here's one we haven't talked about. If you do metabolic conditioning or Max T3, it increases your sensitivity to insulin. This is pretty important for anybody in here that's type 2 diabetic or pre-diabetic, or your blood sugar has been tested high at some point by the doctor. This is extremely important to you. Now, type 1 diabetes, it's a different animal, okay? But type 2 and pre-diabetics, that's a lifestyle factor, and you can reverse that 100% with lifestyle changes, okay? Now, are there drugs for it? Yeah. Is that the best route to go? No. I can already tell you one of them, Avandia, on the market has been shown to cause increased risk of cardiovascular events, heart attacks, okay? And it's probably only a matter of time before the other ones, chase it. So what I'm saying is, a drug is not the best approach to fixing something that's a lifestyle issue. And that's what type 2 diabetes is. That's what prediabetes is. So, because metabolic conditioning increases sensitivity to insulin, what that means, I'll tell you a quick story again about insulin. So when you eat a food, especially one that's sugary or full of carbohydrates, it causes your blood sugar to go up, okay? And then your body kicks out insulin, and insulin's job is to tell the sugar in the blood to get out of the blood and go into the cells. So insulin drives down your blood sugar, okay? Way more information you guys probably want to know. But here's what happens. When you don't eat very well and you're eating way too much sugar or carbohydrate and you're not doing any exercise to burn it off, you continue to have that blood sugar that's high, your body tries to keep pumping out insulin to lower the blood sugar, and pretty soon, the same thing that happens with the leptin in the brain, where the brain doesn't want to listen anymore and you become leptin resistant, like we just talked about, same thing happens here. Insulin resistance. Your cells become resistant to insulin, where they say, we've heard insulin so much trying to jam more sugar into us, we don't want it anymore. We're not listening to insulin anymore. So now what do? We keep eating the foods, we're not exercising, the blood sugar's going up, the body's panicking because the blood sugar is getting so high, it's trying to kick out more insulin, but the cell doesn't want it anymore. So then we go to the doctor tests our blood, they say your blood sugar is 600, and there you go, here's your pill, right? Well, if you do metabolic conditioning, you reverse that. You reverse the insulin sensitivity, you make your cells sensitive to the insulin again, and then you don't have that problem. So if you're a type 2 diabetic or you're pre-diabetic, you got to get on this. It's not even an option. You got to do it. Yeah. Go ahead.
So,
I usually don't take questions
would that
all
help
at
with
once.
like sweet cravings on it?
Well, I'll take questions afterwards.
Oh, okay.
Go ahead. No,
Would that help with sweet cravings too?
with this?
Like let's say you have regular sweet cravings.
Yes. To answer your question, yes. And the reason that it does is because usually a sweet craving will come from your blood sugar swinging, okay? You want your blood sugar to maintain at a fairly steady level all day long, okay? And what happens, if you're getting like cravings, more than likely your blood sugar is crashing. And usually it crashes, sometimes if you haven't eaten enough in a long period of time, it'll start to get low. But if your body's functioning the way it should, you should be able to go without food for a while without having a crash, because your body will break down stores to keep it up. Usually, though, the reason you crash is because you spiked. You ate something that was too sugary, too much carbohydrate, you got a spike in the blood sugar, and then your body pumped out a bunch of insulin to try to drive it down, but it went too far in the other direction. So now your blood sugar is low.